Good afternoon, everybody. Welcome to this afternoon's webinar. We are looking at managing childhood vaccination delivery for SystmOne practices using Ardens. We're going to just go through the resources that we've built for this, and obviously kind of linked to the latest kind of changes to the schedule. We'll be going through this. And just for welcome, so obviously I'm Nathan. You've probably seen me before. I'm training specialist lead for Ardens SystmOne. Charmaine is head of training, so she's kind of going to be my, I say, wing woman for today's webinar. So but I'll be mainly doing the presenting, and then just so you all know, we've got Stuart, one of our senior developers, and Tudor, who is one of our GP developers. They will be manning the Q&A, I guess, alongside Charmaine as well. You'll be doing a bit as well with that. You've got four of us. I'll be doing the presenting. I probably won't be looking at the Q&As, but I will kind of break just to see if there's any questions and stuff for me to answer. But those guys will be beavering away in the background if you do have any questions. I think we'll get started. There's probably more people joining, but we'll go. This is recorded. So just as we always do, a bit of housekeeping at the start. So as you know, with these webinars, the way they're set up, your camera and microphone are disabled, so we won't be able to kind of see or hear you. I'll talk about this in a minute. We'll do a Q&A at the end where we might be able to disable those if you do have questions, but throughout the webinar they will be disabled. But as I said just now, we've got Stuart and Tudor and Charmaine. They'll be fielding the Q&A, so do ask any questions that you have in that Q&A section, and they should be able to kind of answer you. And we'll also put some links and stuff. I might mention a link and they'll put that in the Q&A for you as well. So do keep an eye on that, and just click that Q&A button at the top. I think it's at the top on yours as well. Shouldn't take any more than an hour this session, because we're only looking kind of one bit of the resources. And as with all of our webinars, this is recorded, so we will email you out the recording, but it will also get added to our recorded webinars page with all the other kind of support and other videos we've done. So, and there's no time limit to that, so you can always watch that back, or if you have to duck out at any point, don't worry, you won't miss anything. And then always the common sense bit at the end, please rejoin the meeting. If you have any audio issues, we just turn it off and back on again. I would say, as I say, like going throughout, we'll put any questions in the Q&A, and then at the end, if people have questions still once we've answered all of them, then we will answer them and maybe unmute people there. But for now, any problems or issues you're having, so I know someone's just put their hand up, so just whack it in the Q&A, and we'll be able to answer you in there. That's the housekeeping. So what are we covering today? So just a bit of background, exactly, the kind of whole childhood vaccinations, and a brief summary of kind of what's changed, and what resources we've changed, and then looking at how we can help. So what resources have we built for you? A lot of you may be au fait with some of the stuff we do already. It is just kind of an update to existing kind of functionality, and then I will dive into SystmOne and give you a demonstration. Just mainly, I'll cover exactly what we're going to cover in a minute, but we'll look at kind of the plan, recall, delivering, and then evaluating those resources. And then at the end, we'll have that kind of open Q&A for anyone that's left if you do have any queries. And then, as I say, by then we might be able to kind of unmute you, but until then, do put questions in the Q&A. And at the very end, like we always do, we will talk about what further support there is. So like with everything in Ardens, and I'll reiterate this at the end, training is free. Do use us. This is what we're here for. Sometimes you would probably prefer to do the kind of the training for your practice, which will kind of make more sense, because we can make it more bespoke for you. So don't just think this is it and that's it. You can always put training, and we'll talk about that at the end. So so that's kind of what we're covering. We will let you have the slides as well, because I think on the slides I'm going to use the live demonstration, but on the slides we've got some screenshots and stuff, so we will send that out to you with the video recording as well. So we're looking at the schedule now. I don't know, Charmaine, did you want to do the polls now, or would that be a good thing? Because we're starting to do polls, you see, with these webinars, just to kind of get people interactive. So it's probably a good time to do one now, isn't it, with regards to what everyone's, yeah, what do you think?
You can do. The first question is all around how much they're using the resources. So why don't you just quickly go over the schedule and then I can fire off a question.
That.
That's
Yeah,
all right.
thanks, Charlie. No, don't worry. So just very quickly then, the kind of the change in the vaccination schedule. Now, a lot of this was kind of communicated last year. So there were a couple of changes kind of July last year, which was just kind of an adjustment to the schedule. And the items of service was increased to £12.06. And they kind of they kind of communicated what was going to change on the 1st of January. So this isn't new. This kind of has been around kind of since then. But then from the 1st of January this year is when the kind of the new routine vaccination then came into place. And that is a routine vaccination appointment at 18 months. We've got that extra one at 18 months now. And that is obviously for children born on or after the 1st of July 2024. So then that will just become routine and, you know, we'll all be used to it as they come through. So that was the big change, to say that came into force on the 1st of January. And obviously there's that new combined MMR-V vaccine, which replaces the older MMR. So they've added that varicella to the MMR vaccine. And that is now going to be given at 12 months and at that 18-month appointment. So that's kind of why that's kind of come into force. And then the other thing that's been added to that 18-month is the eligible children will be receiving that 4th dose of the 6-in-1 vaccine at that 18-month appointment as well. So that's the need for that. So they've just kind of rejigged the routine a bit, and they've added that 18-month one. So that's the change of the schedule. We've obviously then had to redo the template, and I remember even last year a lot of people asking where's the 18-month in there. So obviously it's on the template now, and we will kind of go through that with the resources. But yeah, so that's the change in the schedule, which is kind of the need for this webinar today. And then just talking about what we've updated with our resources. Now, obviously, we've aligned, as we do with all of our Ardens resources, we're aligning that to the national guidance. So the template reflects exactly what is expected of us all now. So you're not using, that's why the old one's gone, and we're using that new template. And obviously this then enables that we're recording everything correctly, standardizing, how we all work in line with what we're meant to be doing nationally. And then obviously, and again, a lot of this is kind of what you're used to anyway. The template hasn't changed too much. It's more the schedule and a slight rejig, but you've got that individual page for each age, so it's nice and easy to see exactly what that age needs and the buttons to give that vaccination. And obviously that means the kind of the accurate kind of reporting in the background. And we'll touch on kind of Ardens Manager at the end, but you can then kind of get that data out and see exactly what you've done across your practice, and maybe across a PCN and an ICB as well. So again, that's really, really useful. And not only that, we've updated the reports in the background, which is what I'm going to touch on first. So you probably might have used the childhood vaccination invites. We've kind of rejigged them and made them a bit more advanced, if you like. So we've added a bit more in there, and we've simplified it so it kind of falls in line with how we do our long-term condition invites and the flu invites. So once you know how one invite works for one thing, it's exactly the same. But I'll be covering that first, and then diving into the template. So this is where you wanted the poll, wasn't it, Charmaine? I think now. So sorry, jump the gun.
If you could switch to the next slide. Yeah, we're just really interested to see exactly what resources you're currently using of ours at the moment. So I'm just going to launch a poll question now, and if you've got a second just to hit the options, you can choose more than one. Hopefully you are using more than one of our resources here, but rest assured if you're not, we are going to be showing you what they all look like today. So fire your questions away, and that gives us a good idea of kind of where you're at the moment.
Real. Yeah, thanks, Charmaine. So while you're all answering that, I just wanted to kind of go through how we can help, and this is going to be the structure of what I'm covering today. So we kind of do this whole kind of plan, recall, deliver, evaluate, kind of like it's almost like a journey, if you like. The plan, and I'll cover this first when we dive into SystmOne, we're kind of looking at like some reports we can use to review before we send our invites out, just to make sure our data is up to date and there's not going to be any problems when we do our invites. looking at the cohorts and an idea of numbers that are going to be due, so we can use those to kind of pre-plan our appointments, make sure we've got enough appointments, and keep on top of, we know next month might be a busier month for childhood vaccinations than the previous month. So looking at that, kind of planning your clinics and what you can do. So I'll show you the reports around that. Then the whole recall section, so actually doing the invites, which kind of follows on from that plan. So the reports that you can use literally to go, right, that's who we need to invite, and sending them that invite. So I'll show you where they live. Then the delivering of it. I imagine most of you are probably used to using the Ardens template for the childhood vaccination. So, I don't, there's nothing majorly changed. I will obviously show you where it has changed on the template, but it's more in line with, the new 18 months. So, just got that extra tab and things, but there's not a drastic change. So I'm hoping that should make sense to you. And then just evaluating then, once we've done those vaccinations, where can I see how many were given, and looking at those insights. And again, I'll quickly show you Ardens Manager at the end as well with regards to that. But I think my focus is more on how the reports have changed and how you can use them. The template shouldn't be much different. So it's not like it's completely different to what you're currently doing. It should be very, very similar. So it's more the reports that have changed a bit more. And as you see, those resources, it's those templates and reports and the dashboards that we can provide you with that. So I think with that structure in mind, then what I'm going to do is I'm going to dive into SystmOne, and I'm going to go through those resources and show you where they are. So I'm just going to come out of my
just while you're doing that,
now.
Nathan.
Yeah.
Just while you're doing that, like the results showed that most responders are definitely using the template. More than half of them are using it, but not so many people are using the bravery certificates. A handful of people using the reports, and very little on the dashboard. So hopefully we can change that by the end of the webinar.
Yeah, it's kind of what I suspected, because most of the time when I'm going out training, a lot of you all know the template, but not everyone realizes we've actually got those reports to identify the childhood vaccinations. And I think the ones before, and I guess it does depend, because in some areas these are done kind of centrally, and then people might use our reports to kind of follow up, or they just, they're a lot more kind of robust, and there's a bit more there to kind of help you. So yeah, hopefully we'll get you using those. So with that in mind, that's where I'm going to start. So you can see my SystmOne. I'm currently in a patient record, but what we're actually going to do is we're going to dive into the reports, and I'll show you where those reports live, and I'll just go through those options. So again, you should probably all know this. I'm going to go up to reporting at the top, and I'm going to go to clinical reporting. And in here, I'm already there, but I'm just going to scroll to the top so you know exactly where I am. We've got, your usual screen. You'll have your own reports, you'll have local reports built by the practice, and then you will all have access to our Ardens Limited folder, where all of our reports live. Now, this is A to Z when you open it up. Now, the only folder that I'm interested in is right down the bottom, because it begins with a V, and I've already got it open. We want to navigate to the vaccinations folder within the Ardens Limited folder in clinical reporting, and this is where we've got all of our reports. If you've watched any of our webinars before for flu, it's the same folder. You'll probably know exactly where to go. But in there, and because this is A to Z, you will see, and this is what we're going to look at from there down to there. This is what we're focusing on today. So we've got our childhood, and you'll notice it says Jan 26, so we know it's been updated. This is our little suite of reports that you can use to manage and effectively recall your patients. Now, thinking about that kind of planning stage before you do your invites, the first few subfolders in here will help you with that. So I'm going to go for each one basically, and hopefully it will make sense. And so the first one we've got here, childhood Jan 26, 1 cohort. This is a very, very simple report. You can run this when you want, but basically what it's doing is it's showing you the cohort of current children that can have or may already have, it doesn't matter if they've had it or not, they might have declined, but it's just basically the number of children that fall into the childhood cohort. So use this as just a guide to see, how many children can or can't or have had it. So it doesn't differentiate between anything. It's just telling you in total, at our practice, 287 children fall into that cohort of the childhood vaccinations. And that's it. You might not ever run that. You might use it just to have an idea of the numbers of children and appointments that you might need to be doing. Again, that is completely up to you, but that's all it's doing. And it's classing that as anyone over 4 weeks old up until they are 4 years of age, because that's essentially when you would have all of those childhood vaccinations. So that's all that report is, and you can run that to get an idea of the total number. It's kind of no different if you've done the flu ones, you know, your total flu population of those that can have it or have had it. It's just that it's the same thing, but just for childhood vaccinations. So that's your cohorts. Nice and simple. Next one for kind of planning is we've got this review before. And again, you know, we say review before. You can run these whenever. You can run these before you start doing your invites. You just kind of keep on top of them. And again, it's up for practice to, you know, determine when these are useful to run. But these reports, and again, you can see each one, they're the same thing. They're just divided by, you know, 8 week, your 12 week, your 16 week, 12. It's the schedule, basically. It's divided up as. But let's just choose the top one because they all flow the same way. This is basically looking at anyone that's in that cohort. So, you know, review age, they're under 4. And they have a declined code for their 8-week immunizations, vaccinations are recorded in the last 12 months, and their 8-week vaccines are incomplete. So with the case of that top one, none of these children have had their 8-week vaccines, and they either have a declined code or a vaccination refusal coded. So in SystmOne, you can either add the code or you can put a vaccination refusal. This report will look at both of those things. And if they've got that and they've not had their 8-week vaccines, you can run those reports. Now, you might have 0, which is great. What you do with those children is up to you. I guess it's a data check just to check, should they have been declined? You know, should they have refused that vaccine? You know, why have they done it? Was it coded in error? What's going on? Can we do anything about it? How you deal with that, again, is up to you as a practice, but at least you can identify these patients so you know, should we review these patients and see if we can actually get them in any way? Well, you know, speak to whoever and is there a chance we could get them in? Was it coded wrong? So that's what those are for. And then it just breaks down your 12-week and haven't had the 12-week vaccines, 16-week, haven't had the 16 weeks, etc. That is only looking at the last 12 months, though. That was coded for that decline code. And again, that is it. That's what those are. So run those when you like, but you can just at least have an idea of anyone that might have declined and should they have done. And then we've got the due soon and due now. So there has been a little bit of confusion around what the due soons mean, but I'll start on the due soon. The idea behind these reports is to give you an idea of how many children will be needing appointments soon. So you can kind of plan ahead if you like. Again, it all depends how you work as a practice. We're just giving you the choice, the resource, if you want to use it or not, or you might want to use the due nows, which I'll talk about in a minute. But the best thing to say, the one that you'll have the most patients in, is the first one. And as you can see, it says due 8-week childhood vaccine soon. And what it's doing is it's looking at children between the ages of 4 weeks up until they're 8 weeks old. So this is telling me the last time I ran this, I've got 7 children. Now, they don't necessarily need it now because they're not 8 weeks old yet, but it will give me an idea that we know 7 children will need one within the next 4 weeks. Let's start looking at making sure we've got the appointments for them before we invite them in. So you can just plan ahead, and it's just giving you that idea of how many there are. Don't use these for your invites. We'll come on to that in a minute. It is using these reports, but we break the invites down in an easier method. You're just telling you how many you need to invite in. Now, the 8-week, you're always going to have patients in because it's always looking ahead. We do then have one, which is they're due their 12-week childhood vaccines soon as aged between 8 weeks up to 12 weeks. So they're in that 4-week gap between needing their 12-week immunizations. The problem here, well, it's not a problem, but you will likely have 0 patients in there because there has to be a 4-week gap between your 8 weeks and your 12 weeks. So the only time you would have patients in this report would be, because remember, this is looking at due soon, is if they were given their 8-week vaccines early, say at 7 weeks, after 4 weeks, when they're 11 weeks old, they will fall onto that report, and then you could then plan ahead. But if the children are having their if they're 8 weeks, if they're having their vaccine at 8 weeks or onwards, they won't fall into that report because they're on time, and it's going to be due now. So the top one, you're definitely going to have numbers in. The rest of them, you'll only have numbers in if they are given the previous vaccine early. So again, use them how you want, and it just means you can plan ahead and go, I know they're going to be due soon, so let's make sure we got the appointment available for them. So that's what those are for. But again, most of the time, the most useful one is that first one, but we have built it for each kind of one. Now, any patient on, let's again use the 8 week, obviously they will be on that report between the ages of 4 weeks up to they're 8 weeks old. As soon as they hit 8 weeks old, and they have, the other thing to say is these children have not had their vaccines on this one or refused, so they can have it if they've declined or they've had the vaccine in that top one. They won't be in that report, so it's saying basically they haven't had it yet. So if they've still not had it and they hit 8 weeks, they will disappear off that report. But what will happen is they'll just move on to the due now reports, and they're doing the same thing, but they're due now, basically. And again, if you read the top one, due 8 week childhood vaccines now as they're aged between over 8 weeks up until they're 4 years old. So it's the cohort basically. So and that's telling me I've got 6 children who have not yet had their 8 week vaccine, but they're due it now. So we know that they really need an appointment booking soon because they are due. So that's the difference. The due soon is looking ahead. The due now, you're always going to get numbers in here because each one, 12-week childhood vaccines due now as it's been 4 weeks since their 8 week vaccines. So these are, as soon as 4 weeks since their first 8 week one, they'll fall onto the 12 week. And then once they're given that, they'll fall onto the 16 week. So they'll only appear in those subsequent ones as long as they've had the 8 week vaccination. And it just show you who needs those now. So that's the difference. Due soon, looking ahead. Due now, they need it now. And it just gives you numbers. I'm probably over explaining it. It is literally that. But don't use those for your invites. That's when the invite section. So we're getting onto like the planning stage now, if that makes sense. So, you can use those to have an idea of numbers. I'll go for the invite and then I'll see if there are any questions. So the invites are then split, and you'll notice we've got invite is due soon or first invite is due now. And again, the same concept. It's looking at these ones, but we've done them in a way that looks to see well, if they're due it, but then you can use these to actually send your invites because it works off a first, second, third recall process. So again, the idea is if you went to the due soons, you can see it's then divided 8, 12, 16, 12 month, 18 month, 3 years, 4 months. And we're now using the format we use across the board for the LTCs, for the flus, for your invites. And in theory, that top report there is saying, these patients are going to be due their 8 week vaccine soon. So again, it's that 4 week period up to it. But the idea is, as a practice, if you wanted to, you could use that report to invite these children in now in preparation for it being due in up to 4 weeks time. You don't have to, you could just go to the due nows. That again, it's up to you. Some practices like to plan ahead. Some people just do it once they're due. So, we're just giving you the resource to run if you want to. And the idea is you would then use those to invite them. So that's what the due soons are. Again, it's the same concept, like I said just now. Once they're then due, you can just use the first invite as due now. So, if you never run the due soons, they will eventually fall into the due now, so you won't lose them. It just means you can plan ahead. Failing that, you can just go to your first. I'll go through in a bit more detail the actual invite bit now on the due nows. Failing that, you've got first invite as due now, and again broken by each one. And the idea is if I run that, that's showing me every single child who is due their 8 week vaccines now, and we can run these reports to invite them. Now, it's up to you how you do this, but just to explain, if you don't know this format already, that is all of them. What it does is it breaks it down by the various methods we can invite them. So this one would basically look to see if the patient had any of these things coded. Now, it's very unlikely a child would have a lot of these, but we put it in there as a safety measure. So learning disabilities, dementias, SMIs, end of life, or reasonable adjustments. I guess in the case of children, it's going to be more one thing than another. But the idea is, rather than send it to all of them, I would go through each of these. So run that one, we've got 0, great. But if we ran that one and we had a patient in there, we check the patient, see who it is, and invite them appropriately, depending on what it is that they need, a reasonable adjustment or something. And again, in this case, because they're children, it's going to be an invite to the parents anyway, really. The next one is the bulk of the patients will fall into this one, and this is basically where their preferred contact method recorded in SystmOne is either SMS, email, AirMid, or it's set as unknown. And in theory, these are all of the patients that you can text or email and invite to. Now, you could extract that report into AccuRx and use that. Or failing that, if I was to right click and go to actions, there is the option within SystmOne to use the communications annex, and you could bulk send those patients or the parents of those patients a text message to invite them in. And how you can set that up at your practice. You've probably already got a mechanism of how you're inviting them. This just tells you who to invite. And then it's just worth noting, you've got this one that says letter. You'll have less patients on there, but if you've got any patient that have said my preferred contact method is a letter, you would run that and just check those patients and invite them how you want, send them a letter. I guess, to be honest, you'd probably call them or do it in other means, but we're just basing it off of their preferred contact method. And then the last one, I don't think you'd ever really get anyone on that one, but if they have said their preferred contact method is no communication, they would fall into that, and then you would just have to decide as a practice, how are we going to invite them? To be honest, I imagine, especially when it's childhood vaccinations, the majority of your patients are going to fall under that electronic communications annex one. But do just check, and how you invite them is up to you, but that's how we've kind of devised it to identify it. Now, once you've invited those patients, it is important to code that you've invited them. Now, because there's too many codes for the invites, we can't put them on this page. I'll get one of the guys to put a link to the support article, but I'm just going to go to my web browser. So we've got this support article that guides you through these resources. But if I run down on here, so a lot of this is just basically what I'm talking about, but we have on this page the actual invite codes that you can use. So your 8-week invite codes there, your 12 weeks, your 16, etc. And these are the SNOMED codes. I know they're a bit longer than a recode, but we are all meant to use SNOMED codes now. These are the codes you want to add to each patient you've invited to say that you've invited them. So do have this saved somewhere. You could probably add these as a preset when you add a read code using the bulk actions if you wanted to make it easier to find. We can't do that for you at our end, unfortunately, but we have listed them on this support article, so say we can share this with you. But the idea is, if we were sending the first invite for an 8-week, this is the code we want to do, so I could just copy that if I wanted to. And if I go back here, any of these, when I invite them, there is the bulk action of add the code there. And if I click that, brings up your browser, paste the code in, and then it will find the code we need, and that will add that code in bulk to all of those patients in one go. Or if you do it individually, you can just do it on each individual record. It's up to you. But as long as you add that code, what will happen is when you rerun that search tomorrow, if let's just say that we've got 8 on there, so if you invited all 8 of those patients and added that code to all 8, when I rerun that search tomorrow, that will be 0. But what you'll notice is on the left-hand side here, we've got second invite as due now, and they would then fall onto those reports there because they've already had one invite. And what these reports do is, if you invite the patient in and code them, 2 weeks after you added that code to their notes, if they have not had that 8-week vaccinations, they will fall onto those reports there. And then you do the same again, send another invite, code it again, and then that will move them on to the third invites. And again, I'm only showing you the 8 weeks, but it's exactly the same for your 12 weeks, for your 16 weeks, 12 month, etc. It's no different. The process is the same. It's just picking up the patients that you need. So again, just to very clarify, due now, run the age you want, invite how you want, code, that'll move into a second and third invite after 2 weeks once you've coded it. So I'm hoping that makes sense. Before I move on to next, is there any questions? The guys in the Q&A?
Yeah, I think it might be worth addressing the question about, I know you're going to go onto the template, but it's a question that's been answered a couple of times, and Tudor might be able to give a bit more context if he's happy, but it's around the SCID not being in the template anymore. So it's my understanding that you need to do a full clinical check first, hence why it's been removed. But Tudor, are you there just to give it a little bit of context before we launch the template? I'm sure that question will be answered again.
Of course, yes, yeah. So, so the thought was that the SCIDs, obviously the SCID has to be coded correctly for it to be in the record, which we don't want people to rely completely on the coding that's in there. And so we want them to do a clinical check of the patient. And also in the 8-week template, there are those 2 elements already where there's the area that you can tick to say the newborn blood spot screening status has been checked, which is what tracks the SCIDs. And also there's the area that you do the contraindication to live vaccination, which helps to cover for everything, not just SCIDs, but the other contraindications to live vaccinations.
Well,
thanks,
Tudor. Yeah,
amazing.
Point those bits out on the template when we get to it as well, but yeah, thank you.
You want another one just before you go? This
yeah.
One on the reports. It's just about non-responders, because we know that can be quite a challenge for practices, can't we? Non-responders. They're still appearing in searches reports. Sorry, will they ever be removed, or will they just sit there in the reports?
Yeah. So is that when they say non-responders? Is it people that have? Sorry, Stu, do you want to come in then? You probably, because you built the.
Go for it.
I was just going to say, did you want me to answer this? So
yeah, go on then.
Literally, because I was typing out a response. So the only way to remove someone from an invitation report is either to record that they've had the vaccination, or to record an exclusion criteria, which is either a adverse reaction / allergy, or a decline or contraindication or refusal. Now, obviously, you can only record those if you have received that information from the patient. You can't just go and use them to remove patients from the report. But those are the only way that someone will come out of an invitation report. The declines and contraindications are an expiring exclusion. So if you happen to receive a letter or communication from a parent saying we decline this vaccination, and you code it in the record, it will only last for 12 months, and then they'll reappear again to say, look, 12, this person's now a year older. Have they changed their mind? But that's what happens with those. There's no mechanism to say, please remove this because the patient's not responding.
Thanks,
Stuart.
Cheers.
Sorry.
So yeah, and I guess with regards to that, obviously, once they've had the invite, you get a first, second, third, but then it kind of tees up nice for this one, because there's another subfolder here which is follow up as invite as due now. So these are basically looking at patients that have not had those so for example 8 week, they've not had that vaccine, and it's been a year since their third invite. So they kind of, once they've had the third invite, if they've had 3 invites and a non-responder, they don't disappear, but they'll fall off these ones once you've coded them. But they would then, after a year, fall onto the follow-up invite as due now. So then you can review these, and you'll probably get a lot of zeros in there. But anyone that they had 3 invites, they're a non-responder, after a year, you can run these. I mean, you can run these, as often as you like, and that will show you who those patients are that it still didn't come in and have not had those vaccines. So then you can at least manage them in that and decide what you want to do with them as well. So they will move through the process and they'll fall onto that follow-up invite. But as I say, they won't fall onto that until 12 months after their third invite if they've not had the, in the case of that one I've got highlighted, the 8-week vaccine, but obviously 12, 16, whichever one that you're running. So just worth knowing, you can kind of use that for your housekeeping with regards to some of those patients if you wanted to. So yeah, I was going to kind of, well, let's kind of do the invite bit and we'll fall onto the review after. But I'm going to jump into the template, and I'm hoping the template should make sense to a lot of you. But is there any other questions around the reports before I move on? Just because I feel like the reports is the biggest bit for this. That's changed.
Let's have a look, see if there's any. We've been asked how often do we think practices should be running the reports. I suppose it's dependent on their processes, but the review before, I don't know if you agree, I always say run it every single time you're about to do a bulk load of invites to make sure that your lists are accurate. That everything else, I suppose, is dependent. And I suppose the due ones, like you said, they're just for planning purposes. That is it, nothing to do with inviting. So that would vary as well. I think we're okay for now.
Yeah, cool. Yeah, I just in relation to that, I mean, I think the way I would do, I mean, again, it's never been my job, but I would probably just be running those invites. I'd check if, I'd probably do the review before, just see if anyone's been added to it. But then I would just check, are there any due seen? But I might just do the due nows for now. But again, that's me. Every practice is different. But like you say, that just the due soon and due now that aren't the invite ones, I probably wouldn't be running those much unless I need to plan a clinic or something because we've got a lack of staff. It's mainly the invite ones that you'll be running kind of regularly, and it might be every week, every couple of weeks. But again, it depends on the practice really. So. Cool.
This one might be a good one though. Can we extract the bulk messages into patches directly from Ardens, or we currently have to extract as a CSV when the report has been run?
I think it would just be the CSV. I don't know any other. I'd never used patches, so I don't know. But I imagine the only way to export a lot of these out is just via CSV within SystmOne. So that's kind of the SystmOne functionality and how it talks to that really. So I don't know any more with regards to how you would do that. Sorry.
Fine. And just one last question, I promise.
Yeah. That's all right.
Because it's been answered a couple of times now. We have patients on our invite list. So I think this is more clarity more than anything. We have patients on our invite list. If they decline the vaccine on the first invite, do they drop off the list? So basically, if there's a decline, do they come off the invite reports altogether?
They do, Stu. Just back me up. They do, don't they? Because if you add the decline thing, they're going to come off. Because is that right, Stu? Sorry, that's how I read it.
I was in the middle of answering another question, so please start asking me the question again.
It's about decline, Stuart. So if they put a decline code in, just clarify whether or not the patients would definitely come off the reports, the invite reports.
So if you add a decline code for, and it's a specific decline code for vaccination, as per the report, then yes, a decline code will take them out of the due, which will also take them out of the invites. So decline code only lasts for 12 months. So as mentioned earlier, if they'll reappear. If there are any users finding that they're adding decline codes and it's not removing patients from the reports, my first point would be that it won't do it straight away. They have to wait for the data run to happen overnight. And if it's not happening even then, please contact a support team with details of which report it is and what code you're using to what code you're adding to the record to code the decline, and we can look into it further. But they should, if the vaccination is declined, they should come out of being eligible for that vaccine, so they'll come out of due and out of the invite. Now that is on a per vaccine basis. So to give you an example, at 8 weeks, there are 3 vaccines which make up 8 weeks. If your patient declines 6 in 1, they would still be eligible for rotavirus and NB. So they would still appear in the invitation report because they would still be due those vaccines which haven't had a decline code recorded. Hopefully that's...
Thanks. Yeah, that's really helpful, Stuart. Thank you. Yeah, it's great. It's those little nuances sometimes that, you know, the reports are quite complex, but because Stuart's kind of written a lot of the reports as well, that, you know, it's just getting that, he's got the brains for the logic. So thank you, Stuart. I might move on to the template then, but obviously we can have Q&A at the end if there's anything else with regards to those things. So so I'm just going to go back to my patient. I'm going to click on their name in the top right. So as I say, this won't be much different to what you're currently using. By the sounds of the poll we did at the start, most of you are using this template already. So I'm not too, you know, I'm not going to go into great amounts of detail. I'm not going to go through every single tab because I think you'll be like, I know, Nathan, I know how to do this. But we have our childhood vaccinations template. For those that are using it, you probably are aware we've got the newer version now. There's a couple of ways to get to the template. F12 is the easiest. So when you're in a patient record, if you press F12 on your keyboard, then you will get the launcher come up. As you can see, I've already added it to my favorites list. But if I literally just type childhood, I just put VAC or, you know, VA, hit return, you will notice when I've done the search, the old one and the new one is currently on there. A lot of you might be still have a link to the old, I don't know, but just be aware we've got the one from the 1st of January. That's the one you want to be using now. To be honest, if you go to the old one, it just takes you to the new one anyway. But if you're finding that's annoying, add the new one to your F12, because it will make it a lot easier. And then you can literally just drag that over, which I've already done, and save it as your favorites. Just for those that use auto consultation, if I go to auto consultation, and then if I go, if I go to Ardens IMS and injections, you will notice on there that you've got childhood IMS, which is the old one, but now we've got the new one on there as well. That's exactly the same as what I just showed you, but I would add that to your F12 because it's just easier. So if I go F12, I've already got it on there, double click, and it's going to take us to the template. As I say, it's not drastically changed. It's very similar. We've got our front screen, you know, what are the different vaccines. This is quite nice because if you can't remember what it is, it tells you as well. So, you know, just good for learning purposes. So what do they have at 8 weeks, 12 weeks, 16, 12 months? And there's a new 18-month, and it even tells you, look, all 18-month vaccines for those born on or after the 1st of July, 24. And then it even explains, you know, because the 3 or 4 months, we've got a mixture of patients at the moment. It kind of tells you there, you know, if born on or after the 1st of the 1st, that's what they'd have there. But anyone older than that, they would have their MMR at that stage, sorry, the MMRV, I should say, at that stage of 3 years, 4 months. So it's giving you what that guidance is. And then the idea is you can just go tabs across the top or click your hyperlink on the left to go to each page. Now, just so you know, there is, and it kind of goes on with what we were talking about, we do have that consent page there, and this is just in general. We can just say, you know, we've discussed with the person with parental responsibility, and it's going to basically, ticking these is going to add the consent or dissent codes to the patient record, and you've got one for some or all childhood vaccines. So it saves you having to go to each page. You could, in general, kind of add that there if you wanted to. So just making you aware of that page if you did want to do some review before stuff, and you could use that page to do it. So, you know, it's fairly straightforward. You've just got the tick boxes to add those codes, and you've got the discussion, outcome, and then plan. I'm just going to go back to the home page though, and then obviously, if we just want to actually give it 8 weeks, and again, this is what I don't want to go for every option, but you've got the, now I think it's been rejigged slightly, but essentially you've got the codes to do your administration. So, you know, have we got consent? Are they fit for their immunization? It's the standard stuff you're always chatting about. It would be, you know, you'll be used to this, but you've got these codes. As kind of Tudor was mentioning around the contraindication button, whenever a live vaccine is kind of, you know, on these pages, we've got this a little protocol to the right. And if we click that, what it actually does is it runs a protocol in the record, and it looks to see if the patient has specific codes. And in the case of this, it kind of tells you on this pop-up what codes it's looking for. So, you know, I mean, if they're a child, they're not going to be at this age pregnant, but do they have any of these medications? Do they have the code of a contraindication to a live immunization? It will look for all of these things. If any of those codes are in the patient record, it is going to say yes in big letters here to say they've got that contraindication. In the case of this, it's saying no because that patient hasn't got any of those things. Now, do please check the record. We do say it on there. Look, the patient may still have a contraindication that's not identified by one of the above reports. Please still check that they have, do check it, but it will give you that kind of head start, so they haven't got one of those things, and you can kind of use that to kind of aid in your decision making. So that is just a useful tool that you might not realize is on there, and that's just to the right of where you're kind of, we do that and then we'd say no, and that will code it. So you've got these options, but there you've basically got the buttons to give the vaccine. And as I say, if you know how one tab works, they all work the same way. But if I click it, what it's going to do is it's going to pull through. I mean, it's telling me it's part 3 because I'm actually on a 54-year-old's notes, but it will pull through the batch number, expiry date, and don't forget you can tick your produce FP10 tick box, and it should link it to a vaccination to print off that prescription as well. So that is standard SystmOne functionality that you're used to it. It's no different. We're just pre-filling it and making it easier for you to do it. And it's the same for all of those. I will just say we do have this, the rotavirus, we do get questions about this. And you might see it grayed out. And you might go, well, why is it grayed out? Now, there is a reason. This is not broken. This is all based off of the guidance. This will, and I'm sure Stuart will correct me if I'm wrong, because you're the guru on this, Stu. But this, in the case of 8-week, they will only have that button lit up because they must be under 15 weeks old. So if they're under 15 weeks old and they've not had that first rotavirus, that would be available to be clicked, and it would give that rotavirus. So that's why it would be great. I mean, it would make sense to grayed out on this person because they're actually 54, but it's a good example of why it would be grayed out, and it tells you on the right. And then just a bit at the bottom, there's other things around information. Have we done baby checks? Newborns blood spot screening status checks. So again, that's with regards to what we were talking about earlier. We've got codes to say, are they feeding? We've even got the option of adding a PSD there. So where you've got the PSD, and this is on every page, like once you know how one page works, they all work the same way. If you click the little preset button to the right, that will actually give me some preset text, should I say, where we could say, they're aged, 8 weeks to authorize this to be given. So again, whichever ones are being given, we can add those PSDs. So if I'm not a clinician, but I can do it off a PSD, the clinician can come in here, choose all of those, for example, click OK. It'll add that with the correct code to the notes. And then on the right-hand side, you'd be able to see what previous ones they've had. So just a useful tool. I mean, you probably wouldn't do them all in one go like that, but you get the idea. You can kind of add them like so. And there's even like things to say, why it was not given, and there's some of those adverse reaction to vaccines. So again, some of the stuff Stu was saying with regards to the codes to the consent or adverse reaction, or maybe they DNA'd. So you've got these options at the bottom as well. But it's fairly self-explanatory, really. You've got the codes and those. Stu.
I'm going to take this option because A, because you mentioned me, and B, because you brought that up. I'm going to take this moment just to talk more about the decline codes, because there have been a few people asking questions about those. So if the reports work by exact decline per vaccine. So to remove people from the reports by decline, you have to code a decline to the vaccine. So specifically, give me a sec, failing because I had it on my other screen. So to give rotavirus as an example, you would code first rotavirus vaccination declined or rotavirus vaccination declined. And similarly for Men B, you're looking at a code of booster Men B vaccine declined or first Men B vaccine declined. Any specific vaccine decline code recorded in the last 12 months for each of the vaccines at that stage. So to answer one of the questions that had been asked a moment ago, the code in that not given, which is it's perfect for recording a reason why, but that immunisation consent not given code is not a specific decline code that will take people out of the reports.
Perfect. Thanks, Stu.
Okay.
It's good to know. Yeah, brilliant. Thank you. And then basically, I'll just go through them. So if we go to the 12-week tab, can you see how it's very similar? But again, just to reiterate about the rotavirus on this one, again, this will be grayed out. And again, we get more questions on this one, I think, because they must be under 24 weeks old to have the Rotarix, but they need to have had the 8-week jab for that. And I think it's 4 weeks, isn't it, Stu? I think it has to be 4 weeks since they had that for that to light up. So again, sometimes people come in, it's been 3 weeks and 5 days, and that will be grayed out. And they'll be like, well, I can give it now. It's got to be after 4 weeks. So, it's not wrong. It's just not at the right time that the patient is in. So again, we get a lot of queries about that, but it does work and it is based off of the guidance for that vaccine. So yes, that's those. But again, I think a lot of these kind of make sense. You've got the codes and the buttons to give that. I think if I go to each kind of tab, and I will just show you the 18-month one as well. So again, very similar ones, but let's just see on the 18th month again, it just kind of gives you, there's the new MMRV. So this is all set, and again, it even tells you, look, only for children born on or after the 1st of July 24. So the pages are giving you that information. And again, if I go to the 3 years 4 months tab, this again had a few queries because there's depending on their age, you have to give different things. So we've listed on there if they're born on or after the 1st of January 25, you're only giving those. But if they were born before that date, you're also given the MMRV. One last thing with that, again, we've had a few queries of people saying, well, they're 3 years 4 months, they're the old schedule, I just need to give them MMR. It's always MMRV now because it's just that varicella added to the MMR vaccine. So you're still giving that, even if it doesn't say MMR, it doesn't matter if it's the first time or whichever one, if they're not in the cohort of patients that have the 18-month one, you can still give them the MMRV here. It's the same thing. It's just kind of got that extra, the varicella on there as well. So I just kind of wanted to highlight that one as well. But as I say, the templates are kind of nice and easy. You're probably used to those. Some of you might wonder where the bravery certificates are. They are now on the resources tab at the end. If you go there, then you've actually got a link to the bravery certificates and other useful kind of leaflets that you might want to send the patients. If I click bravery certificates, then again, if you've not seen this before, you can just kind of choose one of these things and, monster truck, and that will just open up in Word, which will probably take ages to load now. So, but they're quite useful things that you can do for those. I don't know if everyone said they were aware of them in the poll, but that's the tab that they're on as well. So yes, but yeah, I mean, that's a template again. Charmaine, I don't know if there's anything else worth adding, or if you've seen anything in the chat.
No, I was going to say about MMR, but you answered that nicely. I was going to invite Tudor in, but you've answered it now, so I think we're all good on that. I think we are cool, and not many people are using these bravery certificates from the poll result. So hopefully we'll see more of that being used.
Yeah, cool.
But yeah, we're all good on template.
Excellent. Thanks, Charmaine. Brill. Yeah, so I'll just kind of close up then. So that's a template, and then just a couple of other things. If I go back to our reporting and clinical reporting, the last bit, we're going back to our childhood ones. The last one here, we got review after. And again, it kind of ties in with some of the stuff we've talked already. These are just good things to see. Have they just got an incomplete primary course? The top two on there is essentially just looking at anyone under the age of 25 who have either not had all their 12-month vaccines, so that's the 8, 12, 16, those ones, or anyone under 25 who have not had all of their 3-year 4-month vaccines recorded. So I guess what you could do with them, you might have some data check-in, or maybe you want to do some summarizing or something like that of patients that have just got that missing, might have had it, gaps in your data. You can use those to kind of go over those if you want to and check, was it done? Did we not just code it because they're a newer patient, whatever. So you can use whatever you like with those. And then these ones are broken down by the primary course. So basically, anyone in complete primary course. So once they hit 10 weeks, so 2 weeks after they meant to have had the 8-week immunizations, they will fall onto that up until they're a year old. So we can look at those patients, go, why have they not had their 8-week vaccines? Because they're now 10 weeks up to a year old. They've got something missing. Let's work out what's going on. So you can use this as like a data checking tidy up, and it's just the same as your 12 week, your 16 weeks, etc. So that's for each kind of scheduled course, or the same reports but for each individual vaccine. So your 6-in-1s, there's your MMR/MMRV, your pneumococcal, your rotavirus. So again, it's now gone past the date they should have had it, but they've not had it. So again, just really good mop-ups and things that you can use for those. So yeah, that kind of ties in with that. And just very quickly before we open up to Q&A, it's taking longer than I thought this one. I'm just going to quickly talk about Ardens Manager. So again, if you're using Ardens Manager, great, and there's some useful dashboards you can do in this. So for those that don't know, Ardens Managers are like our population health management tool, where it extracts the data out of SystmOne and EMIS, the clinical system, and then we can start kind of trending and looking at the data in kind of more depth, and it's really kind of come on leaps and bounds as well. So I'm just going to show you some dummy data. We've just got a dashboard for the vaccinations. So
I'll launch the poll, Nathan.
Thank you, Charmaine. Sorry.
Yeah. Gives us an idea.
Yeah. So just give us an idea, who's using it. But you can trial this as well. Like we do have a kind of a trial of the Ardens National. Some of you might be using it for your local contracts and things. But again, this is going to be dummy data, but there is a dashboard. If I go to services and vaccinations, where we can pull through data. Now, this is dummy data, so please don't take the numbers at heart. But at the top under vaccinations, I can click childhood, and it's just going to kind of give us an overview of all the various vaccines that have been given at my practice. You can see this is dummy data, and you can see the sorts of numbers. But what's really nice is if we dive into this data, the data's basically uploaded every day automatically. So we can look at trends. We can look at how were we doing last week, the week before, and we can see kind of how we're doing. I've done MMRV, let's really just start doing it. But the other good thing here is you can look at this data, and if you're across a PCN or an ICB or something like that, you can start trending the data, so you can see how your practices are doing. So can you see here, I've got 3 practices: Garden View, Sunrise, or Willowbrook Medical Group. So I would be able to see how each individual area is kind of doing at a glance. And we can also see kind of patient information in here. So it will just show us that, I've got 1 patient, but it will show us those patients, and I would be able to look at kind of like some kind of more demographic detail on those guys as well. So you can really kind of dive into that detail. I might just go to one with a few more patients just so you can see what I mean. So that's a better look. You can see like how it's trended. Has it gone up and down? We can do that across the board, and then you can start diving in, see who these patients are. There is even like a kind of a patient view that you can look at of other information, and then we can start diving into this to see, what other conditions do these patients have. And again, I haven't got loads of data on this one, but it's a really good way of like drilling into that data a bit more. I don't know if there's anything else you want to add to that, Charmaine. Sorry, just thinking about the childhood dashboard and stuff.
It's just good for insights, isn't it? Because then you'll be able to see who's actually declining. Is it a particular cohort? Is it a particular demographic? It just gives you greater insights, not just at practice level, but also across PCN, also across your ICB. There's different ways that you can filter down information. You can see what staff are actually given the vaccines. There's so much information there. I recommend that you have a play. We can offer some further training in this area. I think this tends to be looking at the results, it's like 10% of people know it's there, so it's definitely underused. So worth you having a look. But like Nathan said, you have to be a national contract subscriber in order to view this. You can sign up for a free 1-month trial. Definitely a good time now with all of the contract work happening near the end of the year. So we'll pop the details on how you can do that on the Q&A as well.
Cool. Right. Yeah, so sorry, just showing, that's what you just mentioned. So it's quite nice. You can drill down, you can see which staff member actually recorded those vaccinations, and the resource tab won't work on this because it's dummy data. It won't say unknown on yours, but it will tell you the name of the template that they used to record that. So you could actually say, well, for some reason this member of staff or this person or these patients they've used another template. we want to use the Ardens one or something. So it's a really good way of just making sure you've got a bigger picture and like insights, as you say, to everything. So anyway, I'll move on. So I think what we'll probably do, just to wrap it up, is I'll put this up, but we'll do a Q&A while I talk about that as well. I think that's probably the best thing. So just going forward, we'll open up Q&As in a second if there's anything else we need to cover. But just so you know, there is additional training support. So if you scan that QR code, it will link to loads of resources. We've got our Ardens Academy, which is some great kind of user kind of like interactive guides just about Ardens. Doesn't even have to be about childhood vaccinations. Links to our support articles, links to book training, everything. So please use that. Do book training for your practice, and everything can be found on that. I'll leave that up. But yeah, I guess Q&A. Is there anything in the Q&A? Anything else to address, or I guess we could just open this up.
Should we invite Stuart and Tudor to come to help with some questions? If you do have any questions and you want to verbally answer, if you just raise your hand, and then we can unmute you. There have been some questions in the chat, but I think they've been answered really. Tudor, Stuart, is there anything that you want to kind of recap on some of the questions that you've had to answer at all? We kind of picked that up already.
I think that probably the major one would be the MMRV, where I don't think the national guidance was particularly clear when it came out, and that document I've put in a couple of times, which is the MMRV for healthcare professionals. So they updated that twice in the first 2 weeks of January, just to help try and give some clarity about children who were attending their 1 year vaccination, but were kind of attending possibly a week early or a week late, so they were falling into that cohort where it looked like they should have had an MMR, and so people were trying to give them MMR, but the national schedules kind of removed MMR as being part of that national part of the sort of schedule now. So all of it should be moving over to MMRV.
Thank you, Tudor. We did have a hand up, but they put their hand down. So yeah. I don't know whether we answered that question. Oh no, it's back up again. We've got a couple of questions.
Yeah, okay.
Go to you, Stuart.
Yes, I'll unmute you, Marissa, and then you can. You should be able to talk now, Marissa, if you want to ask your question. If you unmute yourself.
Maybe Catherine then.
Yeah.
Oh no, I think
can you hear me?
Yeah.
Hello.
Yeah. Hello.
Yeah. Hi, sorry about that. It's just following on from that 1 year MMRV, which we should be giving, not the MMR. When you're documenting that, for me anyway, it seems that the MMR part of that vaccine, when you're looking at the grid, is documented nicely in the 12-month grid, but the V component switches into the 18-month column. So although I've initially gone in using auto consult and followed the new IMS 1st of January 2026 template that's there, all of that I can complete quite happily. But then when I look at the grid, as I'm saying, the MMR part sits in the 12-month column, but the V component, the Vasarella component, seems to move into the 18 months column. But that to me seems awfully confusing, because they do their second MMRV obviously at 18 months, but for another clinician looking at that grid, it appears like it's already been given. Obviously it hasn't. It's been given at 12 months or just after 12 months, say 12 months and 1 year and 3 months or something like that, but it's just not all tallying up in that grid. I hope I'm making sense. I might be making it confusing.
See, you're talking about the childhood vaccinations grid, aren't you? On the vaccinations node on the tree, is that right?
Yes, that's right. Yeah.
Because so we don't have a say on how that looks. That is kind of hard coded into SystmOne. So it's I mean, without looking at the patient stuff, I don't know how to kind of answer that. That is strange. I don't know if we've heard anything that support this, Joe. I don't know. Sorry if you've seen anything in regards to that. But
I haven't seen any support traffic regarding that query yet. You're welcome to. That sounds like a SystmOne
functionality
thing.
It might be how it interprets the first and second of that on the grid, and without having to play on the grid, I wouldn't be able to give you an answer now. I don't know if it's worth you maybe just messaging our support desk with just the detail, if that makes sense. You don't have to put the patient details in, but if you do like a screenshot and show us the codes where it's added on the record, we might be able to see why it's happening. But I haven't heard that happening anywhere else. But
if you are doing that, please make sure you don't include any patient identifiable information. Yeah,
that's what I see. Yeah. So but that it might be how the SystmOne is interpreting that. So, but yeah, send it through. We can have a look.
Well, I'll send a message over. Thank you.
Thanks, Marissa. No worries. Right, Catherine, let me just unmute you. Catherine, you go for it.
Hiya. It would be really helpful if there was an alert on the home screen for children who are overdue IMS. We're really trying to encourage our clinicians and our receptionists, everyone really, to be taking notice of what's on the home screen. I don't know if that's something that Ardens could set up, or whether you could recommend a way that which reports to use for us to set up the alert ourselves. That would be really helpful.
Yeah, what do you think? I guess that's kind of a development request. I don't know what report you could use, because you could create your own patient status alert. But sorry, Stu, do you want
to? That's exactly perfectly for a development request. So
yeah,
and we would then have a look at that internally as to whether it be appropriate to, and which reports would make sense to use. So I would say if you can email that to us as a request, then it can be discussed amongst the development team as to whether it's appropriate and the best way to do it.
Okay, great, thank you.
No worries. Cheers. And it's Melissa now, isn't it? Yeah. Let me just our mic, because I think you're Melissa. Yeah, you're unmuted.
Oh, hi. Yeah.
Hello.
So we do a lot of off schedule and catch up IMS in our practice. And there isn't sort of a tab that includes all age groups for that, which would be really good going forward if we could have like a catch up tab.
It's on a separate template. Sorry, I should have mentioned that.
Is it? Oh, okay. I wasn't aware of that.
Yeah. No. I should. I was so in the zone with just the Childhood Vax one. So I think it's probably this one you want. So can you see on the page there's a separate template called uncertain incomplete immunisations just there?
Oh yeah.
If you could add this to your F12 favourite, to be honest, it would be easier than having to go in this template. So it's kind of a bit like a one size thing, but you've got the various vaccines in one place, and then you can basically code it on that one, if that makes sense.
Yeah, that's brilliant, rather than like do it freehand.
Yeah. So if you literally search for like uncertain on the F12, you can add it to your favorites and it'll be on there then.
Super, thank you.
That's all right, no worries. I think that's it, because Marissa, we've done you, haven't you? You just got your hand up from before, so I think that if anyone's got any queries and stuff or anything else.
I think we'll definitely look at the Q&A and see whether we can do more of a frequently asked question document that we can share with practices and whoever else needs it. But I think most questions have now been answered. So thank you, Nathan.
Awesome. No worries. I'll just. Oh yeah, go on. Yeah.
Sorry.
Leave it. Leave it as hanging, Stu.
There was one person I saw, and I think a couple of people have asked, is when we spoke about the decline codes earlier, they're asking about where they are on the template. They're not on the template because they have to. They're an admin task to be done at the time of receiving it. But what is available is if you go in, obviously, as you touched on it earlier, Nathan. So I'm just sort of reiterating. If you go into the vaccinate, so you click on the vaccination, you can code a refusal, which works in exactly the same way as a decline. So that is a mechanism where you could find it.
It's that bit of system functionality, isn't it, where you can do it. So what am I doing here? Sorry, the refusal. Did you mean that way, Stu? Sorry. What were we?
Yes. So.
What am I doing? Yeah. Sorry. Why am I being? So yeah, I mean, you can do it on there, can't you? But why can't I see it now? Am I being really blind? Was it not on that one? Maybe you should do it on that one, didn't it, Stu?
Is it under I haven't seen this side of SystmOne in a while. So
I know, but you usually used to do the. I thought there was a thing on the vaccination dialogue where you can do the refusal, but you got the record consent. But usually, what you can do, rather than do it on that way, there is the option when you go to the vaccinations node as well on the tree. There is the right click, and then you can record a vaccination refusal from there, and then just choose your vaccination refusal on there. So if I was to choose that, then you can choose the vaccinate. So I thought it used to be a button on the template like you could do this, but I couldn't see it on there. So then it was like, and then you can choose which vaccination you want to refuse, and that would add the refusal, and that doesn't mean you have to add the code. So yeah, so you can do it that way, basically.
I love it in the chat that people were helping you find where you're.
I know, I'd be so bright. I just like so stupid. It's like, oh my word. I can't see the chat though. I know. Yeah, it's just like it's because I don't. I used to work with SystmOne. I used to do it all the time. And I'm just like, where is that? You know, you're blind to it. And I was like, sorry, yeah, Claire. Let's just do the. Go for it, Claire.
Yeah, the refusal is on the uncertain incomplete template.
Oh yeah, it was, wasn't it? Yeah, I was so, you know, when you see it, and I'm just like, I've done so much talking. I was just kind of like in one of those things. So yeah, it is, isn't it? So you've got the, the consent missed appointment. Yeah, quick refusals. Yeah, you got, it's the same button, isn't it? So you've got the record refusal at the bottom and quick refusals. So that does the same as what I just did on the right click. So quick refusals is actually quite, because you can just tick what they don't want to have, or you can actually go record refusal, and then you've got the options on the drop down there. But they do the same thing. You don't need to add the code. If you do that, that's enough for it to be picked up in our reports and everything like that. So.
Mick's just put something. So Mick is our head of support, and he's just put in a comment around TPP and a maintenance release that they're going to be doing soon around MMRV. So it might be useful having a look at that. It is on the chat currently, so one to be aware of.
Perfect. Right, I'll probably leave the last slide up then. So it's just value your feedback really, because obviously we want these resources to be as good as they can be. So, you know, you can feedback on the session if you like, or just the resort or anything at all. Do scan that and let us know, you know, what you think of the resources, or, you know, anything at all. And yeah, we will read those and take them on board. And then Charmy's just shared a nice little kind of poll around, you know, well, yeah, answer that, you know, which ones
what you're going to be making use of now.
Yeah.
Hopefully it's a lot more than what you were doing. Nice. So whereas before templates was the highest that people were using, bravery certificates and reports were the lowest, now people are saying that they're going to make more use of reports and more use of the bravery certificates. So we've met our learning outcome for the webinar.
Yeah, we have. Brilliant. Happy days. Yeah.
Perfect.
Yeah, just get bamboozled trying to find a refusal. But yeah. But yeah, well, I think we'll wrap up there then. We will share the recording with you, but thanks for joining us at lunchtime. And I'd say we hope you found this useful. And anyone that knows around EMIS, we're doing the EMIS one tomorrow at 1 o'clock, isn't it, Charmaine? I think tomorrow, is it 1? Yeah. So 1 o'clock tomorrow for EMIS. And yeah, I'm sure we'll see you on the next one. But yeah, thanks for your time, everybody, and have a good rest of your day.
Thank you. Thanks, Nathan. Lots of reactions there, which is lovely.
Thank you. Thank you.
Yes.